Hi, I'm Dr. Janet Allenby from Allenby Cosmetic Dermatology. Today we're going to be working on getting a little bit of a butt lift. Very important today is actually having a little bit more lift or fullness in the butt cheeks or the gluteal area. And a lot of people, this is very important. We do a lot of body sculpting in the office because I think we're really finding that people want to have the curves they want, especially down here in South Florida. They want a little bit more lift. As we age, we kind of sag, or maybe we just never had a butt. Now today, you're gonna see when somebody has a little bit of sag, they look a little more bottom heavy here. We're gonna be adding Sculptra, because Sculptra is gonna grow some collagen, which is gonna help give some lift, but it's a real soft look. So when we're looking at this, we're gonna be seeing where our empty spots are, and you can kind of see our areas that are kind of devoid of shape. And what happens is when we put it here and here, it's gonna give a lift and kind of make more of a heart shape for her. The more we can get this up, and you can see the indent that she doesn't like. On the side view, you can see how it kind of just goes flat. And today, that's not what people want, you know. And the good thing about Sculptra is it is something that if the style changes, it does go away with time. And she's not stuck with this versus an implant that can have a lot of problems because it's one surgical, but also we can always add more, or we can leave it alone for a while, you know. So it's very important to make sure that we have something that is not necessarily permanent in this case, because styles do change. This is the Sculptra that we're going to be using. It's been reconstituted, and we're going to be putting it into the tissue here. This is a nice way of improving the area, but a little bit slower, so there's not major changes. Okay, so far we've used a vial in this area. I'm gonna come down here and put a little bit more. We're gonna use a vial and a half on each side for her. You can see how it's rounder and it's more full up here versus this is kind of flat and still saggy looking. Again, I'm using a cannula, not a needle for this. That way I'm not risking any injury to any nerves or vessels. She's not going to be bruised. It's all going to be pretty simple for healing. She is going to massage afterwards as we do for our Sculptra. This side on her, she was a little bit lower with her in her area where she's a little bit more devoid of tissue. She needs a little more softening on these the outer aspect to give her a little more heart shape here.